I'd like to invite our first panel up to the stage. I'm going to introduce them as they're getting situated. So first we have Steve Heilig, who's Associate Executive Director, San Francisco Medical Society, and a Senior Research Associate with Commonweal. Come on up and get your microphones on. Steve is a longtime Senior Research Associate. He's also a co-founder of CHE, and he's also one of our CHE advisors on the CHE advisory team. So please join me in welcoming Steve. Ted Schettler, a science director of the Science and Environmental Health Network, also a co-founder of CHE, also on our advisory group. You'll find he received his MD from Case Western Reserve University, Master's in Public Health, works with a lot of community groups. I've had the pleasure of working with Ted over the years many times, and you'll find more details in your packet of the speaker bios. I invite you to read that as well. Please join me in welcoming Ted. And last but not least, Michael Lerner. Michael probably needs very little introduction in this room. Michael, as we've already heard, is the founder of Commonweal, co-founder of CHE, and overall, pretty amazing visionary. So thank you, Michael, for being who you are, and please join me in welcoming Michael to the stage.
Thank you, Kristen. I'm so honored that this extraordinary community of people has gathered for CHE's 20th anniversary. And I like to think of it not only as CHE's 20th anniversary, but really a 20th anniversary of the field, which I think, the way I count, really kind of goes back 30 years or so. But it goes back to the point at which a small number of us took what was then called the National Toxics Movement, which had crashed, and rebuilt it as the field of environmental health and justice. And there were many people who participated in that, but the renaming of the National Toxics Movement as the field of environmental health and justice, and then the whole set of extraordinary initiatives that have grown out of that is really what I feel we're here to celebrate today. And I feel that those of us in the room were at least significant contributors in many, many different ways to this extraordinary national and global movement for environmental health and justice, which does not limit itself to toxic chemicals. Phil Lee, who was our founding chair, was clear about that from the start, that there are a wide range of other issues that have been involved. So I'm going to stop there and reserve the other 2.5 minutes of my time to the end and ask Steve Heilig, who was there at the start, to share some of his reflection.
I've been affiliated with Commonweal for 28 years now, shockingly. I actually was not, even though I did a degree in environmental sciences way before that, I was not actively involved in the field. I was doing infectious disease epidemiology and clinical ethics and policy. But I was also, as a sideline, a book critic for the San Francisco Chronicle. And I reviewed a book about cancer by one Michael Lerner. I didn't know him yet. My experience was that if you reviewed books, you only heard from authors if they were pissed off at you. But the next day, after the Sunday paper was out, the phone rang and there was Michael Lerner saying, "Thank you for that," which, just struck me immediately as a cool thing. And then he said, "What else do you do?" And we talked a bit. And he said, "Why don't you come out and go for a walk?" Now, I confessed to him later that I'd been out here a lot, sneaking in and surfing out here anyway. But what I realized soon after one of the walks was when Michael Lerner asks you to go out for a walk, something may change in your life after that, if you do okay. So we did various projects, Healthcare Without Harm, cleaning up healthcare itself, antibiotics project, and things like that for, I guess it was about 7 years, working with Michael on things and others at Commonweal. And then he said one day, "Let's go for a walk." And I thought, uh-oh. And so he had written this essay that you have here, kind of conceptualizing a new direction and a new project and collaboration for environmental health. And the vision was basically bringing together a lot of people in different fields, whether they're direct scientists, medical people, environmentalists, and relatively new for that, the patient groups that had organized that were impacted by environmental issues too, and policy people, all kinds of folks. So he said, we talked about this for quite a bit walking around on the beach, and then he said, well, what do you think? Maybe we could get this going if you have the time to work on it too. And I said, okay. And he said, we probably need a few $100,000, maybe even $500,000 or something to really get this going for a while. And I said, okay, well, good. Call me when you got that. Thinking, okay, I got another year off or something like that. He called me like a week later and said, I think we got the money. I went, oh no, when can you start? So we started organizing the thing, which was basically, starting with hiring some staff. And one thing I always remember, this is collaborative, it's beyond science, and we came up with the motto, science and civility, which means good working relationships among people, is we were looking for our first director. And at that point, the office was out here, the work was done here, he really had to work here. And we had, put the word out for people and got a bunch of applications and then winnowed that down to a few applicants. So we had a few, and Michael and I were interviewing him in his office downstairs, and a young woman who was very well qualified came early, and there was still one in front of her. So I remember telling her, it was a day like this, gorgeous. I said, why don't you take a walk out around the forest, see what it looks like here. It's an amazing place. So, okay, she'll come back in half an hour. She came back, sat down, and I said, how was the walk? And she said, man, is it creepy out here? And I always remember looking at Michael and I looking at each other and going, well, now we got to fake this interview because this isn't going to work. But one thing he told me early on there was, I think, quote, maybe the most important skill I've learned in running Commonweal all these years is who to bring in and who to keep out. So the fact that, I always took that as flattering, but for everybody that's been involved in Che since then, it's been really amazing. We've had, a series of directors and other staff, and we had a small group that some of the people here were very involved in, we called Che Core, that was basically trying to get the thing going and running it. So the first thing we did was kind of just an informal organizing meeting here, just to talk about what we might do. I remember I made some buttons for that just had Che Guevara's face on them. And he said, let's not push that angle of it. That's just, And we planned a bigger invitational organizing conference at the Medical Society, which at that point was this beautiful old mansion in the city. And we invited about 40 people from all different fields and had Phil Lee co-chair it, and really kind of laid out what the vision might be and what we might do with a great amount of, and a bunch of you were there, great amount of buy-in into the vision about it, and some debate about how forceful we might be in terms of advocacy, policy, but a real focus on the main thrust of it is to bring all these people together who may not otherwise be in close communication and work in their own silos. And after that, once we got started, we organized a large meeting that was open at UCSF. And this is where Phil Lee comes in. And I'm glad you mentioned him because I was going to. I think you all know who he was, but he was a titan in medicine and public health. The chancellor of UCSF, and before that, twice United States Secretary of Health, and his name being affiliated with us, and the coincidence too that he'd been mentor to both Michael and I even before we knew each other. But his name being affiliated just opened all the doors. And if you walk into the biggest hall at the Parnassus campus of UCSF, it's called Cole Hall, there's 6 giant oil paintings bigger than life, all the chancellors that have been at UCSF. So you walk past Phil Lee when you're going into that hall. And he just died last year, maybe a year before now, 96 or 7 in New York. And he was just an amazing mentor to so many. So we were very fortunate in that regard. And I remember at that UCSF conference, Dick Jackson was one of our speakers. And he came in and he said, first time I ever came to this room, the biggest hall, I was an applicant to medical school as a kid, and they told me, well, you're going to be interviewed by the chancellor. And that's the kind of guy Phil was. He would actually insisted on being involved with medical students from the start, from freshman year on. So wonderful guy. That conference was 250, 300 people. The bigger meetings that went on, you'll hear about the reproductive health one, which was even bigger at the newer campus of UCSF. And we've just gone on from there all these years. I think this journal that's in your packet is just the newest one. By the way, that painting on the cover with the coyote over San Francisco, this was done by my college sweetheart, who has become a dear friend again after a lot of time off, and who has turned into this amazing painter who has exhibits all over the place. So we've tried to spread the word to move it on out, and one example of how that happens is I stopped in quickly downtown coming out here, and I'm walking by, there was a pile of books on the sidewalk, and here's this one called Our Stolen Future, was sitting down there. And so, landmark book, obviously, and we've been so blessed to have the kind of people that we have involved in here. And now I will turn it over to another one who has been involved since the very start, Dr. Ted Schettler.
Thanks, Steve, and thanks, Michael, and thank you all for coming. Yeah, I've had a trip down memory lane the last week or two thinking about this panel. The thing that has struck me about the early years of Che was how much convening we did and collaborating. And we did it in somewhat unique ways. You've heard about the various kinds of people that got involved, scientists of various disciplines, clinicians, public health professionals. We've had government officials in some of our projects. We've had lots of contributions from advocacy groups, and importantly, from health-affected people, individuals who themselves are suffering with environmentally related disorders and are very interested in what are the links to the environment and what does it mean for me. We set up a large number of listservs early on to become content areas for specific environmental health issues. And they were very rapidly populated from people not only around the country, but also around the world who were interested in that particular topic and then wanted to share information about it. They served their purpose, but we also had a number of regional meetings that we convened around the country and on a couple of occasions in Europe, where we came in collaboration with local and regional groups that were working on various areas of common interest to see whether what we could bring to contribute would have lasting value in their work as they went ahead with it after we had left town. I'll give you a couple of examples of how that worked. One of the most popular listservs and topic areas was learning and developmental disabilities. There was a lot of interest and concern around the country that had found a home in Learning Disability Association and the Autism Society of America, where people were really seriously looking at what are the environmental contributors to these changing trends in learning and developmental disabilities and autism, ADHD, and the like. And the science was emerging all of the time. This was an opportunity to bring that information into regions where there were interested groups already working on it, to sort of contribute what we could and then contribute in efforts that went on after we had left. And that really took hold in a number of places and got well grounded. And I want to just fast forward from that story, which goes back 15 and 20 years, to the last 3 or 4 years, where it's now coalesced into a program that's called TENDER, Targeting Environmental Health, or Targeting Environmental Neurodevelopmental Risks, TENDR, which is a collaboration of a large number of academic scientists as well as advocacy groups that are regularly meeting now, reviewing the literature on environmental contributors to neurodevelopmental problems, writing it up for publication in journals, then following that with a media and outreach strategy and policy recommendations that is literally making a difference in places like the Food and Drug Administration, the Environmental Protection Agency, and so on. Now, I'm not claiming credit for Che for that, except that I think we played arguably an important catalytic role in that finally happening over a number of years. A second example is a conference that we convened in 2007 in Sunnyvale, California, on Parkinson's disease. There was emerging science that was showing that we couldn't explain what we were seeing with Parkinson's disease just by genetics, that there must be other contributors to it. Che convened in partnership with Parkinson Action Network, which was an advocacy group for people with Parkinson's disease at the time, convened a conference in which we brought together toxicologists, epidemiologists, geneticists, as well as Parkinson advocacy groups and people with Parkinson's disease for a conference to review the science that showed us the extent to which environmental contributors were known to be contributing or might be contributing. We came to some consensus at that conference. After the conference, wrote it up and published it in the Environmental Health Perspectives as a consensus statement that sort of put this on the map for a much larger community of people. And I'll just sort of finish this train of thought by recognizing that just 2 weeks ago in Chicago, at the American Neurological Association annual meeting, they had for the first time what they called a presidential plenary panel that addressed environmental contributors to both neurodevelopmental problems and neurodegenerative problems in front of this enormous group of clinical neurologists who gathered together from around the country. I think this was really a unique panel. And finally, I'll just mention another popular work group and effort, and that was Che Asthma. There was a lot of interest in asthma and the various environmental contributors to that. And we had a work group that was very active. It was very ably chaired by Polly Hoppen from the University of Massachusetts, Lowell. And we were searching around for a project that we could do early on. And we did a survey of research spending on asthma at the National Institutes of Health and to discover what their emphasis was. And we discovered that in all the asthma research that they were funding, only about 4 or 5% of those dollars were being spent on research for the primary prevention of asthma. Preventing asthma in people who don't already have it. All the other research money was going to how do we treat it, what triggers asthma in people who are sick already. So we decided it would be useful to sort of think that through. And Polly took that idea and put it to work in Massachusetts, where she lives and worked. And along with colleagues from the University of Massachusetts, Lowell, from State Health Department, as well as some support from the Centers for Disease Control, we convened a conference in Massachusetts that was set up specifically to address this question of what do we know about the environmental contributors or risk factors for causing asthma onset in people who aren't already sick with it. And out of that meeting, which included a lot of research scientists, government officials, people from the Department of Transportation, Public Health Department, and so on, we came up with a series of conclusions and recommendations for what was ready for action. Polly and her colleagues then took that into the state government process and got written into the strategic asthma plan for Massachusetts, a section on the primary prevention of asthma and steps that could be taken to do that. This was the first state in the country that had primary prevention of asthma written into its strategic plan for asthma. So we hope that that will serve as a model for asthma strategies in other states around the country. So I think those are just a few examples of the catalytic role that Che played and how they have rippled out in ways that we didn't imagine at the outset, but I think have made really important contributions. So I'll stop there.
Thank you, Ted. And we'll hear more about Che fertility, of course, which was another extraordinarily powerful contribution. I also just want to raise up the work we did on the President's Cancer Panel on Cancer and the Environment, which was an immensely effective piece of work, which Charlotte Brody really encouraged us to do when she was executive director of Commonweal, and which Che was deeply engaged with. In that piece that you have in your folder, the piece I wrote, Imagining Che, called Imagine, it's really interesting to look back on that because a lot of the individual health sectors we really made some progress on. It was very interesting to see which sectors picked it up and which sectors did not. And so it didn't necessarily mean that the sectors that picked it up were the ones that had the best evidence. So there were sectors that really got into it where the evidence was more complicated, and sectors where it was really strong where people didn't follow up. But what I think about when I think about this 20 or 30-year period and our participation in a movement of consciousness in the United States, you think about the immense consumer interest in organic foods, in BPA-free, drinking bottles, in organic clothes, in all the different areas where the American public have basically decided we don't really want, safe cosmetics. Hundreds of areas. EWG has done an extraordinary piece of work on many dimensions of this, where people don't want toxic chemicals in them or around them. All the biomonitoring work that Charlotte and many others have done, people don't want it in our blood, in our bodies, and there's this instinctive movement. But what has not happened that I imagined there was that these different sectors did not come together in a national movement that had collective political power, which was the original theory that if we could build across these different health sectors and create a national and global environmental health movement that had political power, we didn't get that done yet. And it will be very curious in the midst of the poly crisis, where there are so many drivers impinging on us, how that effort to move toward real political power for the environmental health movement plays out.
I'll just say one more thing, too. I mean, I think you all know, or most of you know, the bread and butter of Che, a lot of it has been the webinars we put on an educational sense. We've done hundreds of them. Many of you have spoken, and you'll probably be being asked by Kristen to speak again for that. And finally, the thing I remember, too, is Michael saying at the start, once we had some funding, let's do this for 5 years and see if it works. If it doesn't, we'll let it go, and then we'll see what happens. So it's really great to be here.
Great.